Hello, everyone, and welcome. Thank you so much for joining our webinar. I'm delighted to be here with Dr. Hurwitz from Illume Fertility. Hi, Dr. Hurwitz. We're letting folks trickle in, and I'll just start with a few housekeeping items as we get our meeting going today. We have a really exciting agenda. It's packed with a lot of great information for everyone. So here, you should be able to see my screen. That look good to everyone? Fantastic. All right. So I'll start with a couple logistics. Everyone will be on mute as you join automatically. There is a chat function through Zoom. I think everyone's familiar with how to use that now. You should see a little button that says chat. Any questions you have during the presentation, we have formal time for Q&A at the end. Just chat us your questions. We'll do our best to answer them throughout and definitely at the end. And at the end, we'll be announcing a few special discounts on the IVF Success Program and your initial consultation with Illume. So to introduce myself and Dr. Joshua Hurwitz, I am Angela Rastegar. I'm the CEO and founder of a company called Sunfish. We help people navigate the financial side of the financial and logistical side of going through IVF. I've been in this space for many, many years. I used to be a director at one of the largest fertility companies where I helped hundreds of people navigate their journey. And my team and I started Sunfish because we saw a lot of challenges with the financial and logistical components of going through IVF. And I personally also have gone through 4 rounds of IVF cycles. So I've also been on the patient side. I'm very passionate about making this process easier and better. And our team would be really honored to help alongside your incredible team at Illume Fertility. So Sunfish partners with select clinics throughout the country. We create custom packages along with those clinics to help make the process more affordable and easier for each patient. And so in the tri-state area, we work with Illume. This is a really incredible fertility clinic. There's actually 9 fertility doctors located in 5 locations, and Dr. Joshua Hurwitz has been with Illume for nearly 20 years. He's incredibly experienced and knowledgeable. In addition to working as a reproductive endocrinologist, he's also actually the division director of reproductive endocrinology and OBGYN at Danbury Hospital and has received numerous teaching awards. He and I are also both dog parents. And so we're really excited to talk to you today about first, what makes Illume unique. Dr. Hurwitz is going to talk you through some information about the IVF process, and then I'll talk to you about the special IVF Success bundle that Sunfish offers with Illume. So with that, I'll pass it over to you.
Thank you so much, Angela. It's so good to be here with everybody. We have a big roster here. It's so nice to see how many people are here tonight. In case you couldn't tell on the picture before this, I'm the short, old, bald guy on the right, not the young, hip, cool woman on the left, in case anyone was missing that. So nice to be here tonight. My name's Josh Hurwitz. I've been doing REI for a long time. Here at Illume, we have a very strong passion for helping everyone out there build their family. And that's everyone, period. That's anyone who comes to us. Family building is incredibly important. Family building is a human right? It's actually what everybody needs. What makes us unique, and the reason why I want to talk about us for a second, is just if you're looking at your own clinics in your own geographic areas, this is what we think are important metrics and key indicators that you should look for in your own clinics. Make sure you go to a place that values you as a person, that doesn't look at you as a number. Make sure you're going to a place that only has board certified reproductive endocrinology and infertility specialists. We're called REIs. Okay. Make sure there's convenient for you. So we have one main campus, but we also have 4 or 5 satellite offices to come closer to you. Make sure that works for you, because this can be a lot of work. Make sure also that they're cutting edge, that they are staying at the bleeding edge of our technology, but that they don't lose sight of you as a person, right? Also that they have a robust way of helping you navigate through the financial burden that fertility treatments can sometimes create for people, because not in every state is there great coverage, and not every company has great coverage for their employees. So, here at our practice, I know that my job is to get you through the medical part of this and help you build your family. But there's also another part to this that help you come to us, and that's the financial burden. And that's why we're partnering with a great company like Sunfish. They're really fantastic. All right, let's jump into it. I get asked a lot just in my everyday life and by patients, why does it seem that fertility challenges are so common And what are the actual numbers? Because I hear various things on the internet. Well, let's start here. It is harder than people think to get pregnant. The human being number, if you're trying to get pregnant and timing everything well and everything's perfect in a heterosexual couple out there trying, right? No better than 20% chance per month. That's insanely low, right? If you think about it. The problem is not only is it not a great number, it's not a forever number either. It goes down as we get older, and it goes down with the longer time trying to conceive. So the numbers that we all quote is that for under 35-year-old women, it's about 20% chance per month for the first year of trying. Each month, 20% chance per try. That leaves about 80 to 85% of those people trying to conceive will get pregnant in a year. And the 15 to 20% who do not, those are my patients. That's who we see. All right. Now the numbers change a little bit at 35 to 40. I think we can all agree that nothing gets better as we get older. I mean, look at me, right? So for the 35 to 40-year-olds, it's still 20% chance per month, but now it's only for 6 months. And after that 6 months, the numbers go way down. So both the under 35-year-olds and the 35 to 40-year-olds, 20% for 12 months, 20% for 6 months. Thereafter, it goes way down to a number no one here is going to like to hear, probably 4 or 5% chance per month. So that leaves 1 in 6 couples out there trying to build their family. That's 15% who need some help. That's a lot of people, right? And an important other metric here is that the American Society of Reproductive Medicine has come out with new definitions of infertility or fertility challenges, which include not just what I just mentioned, but also types of people who need help through fertility specialists to conceive, such as same-sex couples, such as single moms by choice, such as people who want to freeze their eggs, gay and lesbian couples, and men and women. So it's just important to keep in mind that there's a lot of ways that people come to us for these types of fertility challenges. We're just kind of mainly focusing on this piece of it. So if we don't mind, Angela, yep, thank you. So one of the most important things when a patient walks through my door is to figure out, do a full and thorough fertility checkup as to what is the root cause of their challenge. Why are they having trouble, right? So it turns out about 40-45% of the time, there could be a male factor involved. So 35% here is a little bit low. So sorry to the gentlemen out there. I don't want to bruise your fragile egos. It's about almost 50-50, right? So there could be a problem with the sperm. It's called a male factor. And that's important to remember. This is a team sport. I remind everybody who walks through my door. The rest of that 50-55%, about 10, maybe 12.5%, we're not going to find an answer, believe it or not. And that's not a blow-off diagnosis. It just means that science doesn't have an answer for you, but there's still a problem. Of the other, 40-45%, there are various problems that can happen on the female side, such as anatomic obstructions to pregnancy at the level of the uterus, blocked tubes, ovulation dysfunctions, or problems with the strength of the ovarian reserve. Ovarian reserve is a fancy term for how much gas is left in the tank. All right. So when a couple walks through the door, we do basically 5 major categories of evaluation. We check the sperm, we check the tubes, we check the uterus. We check to make sure they're healthy for pregnancy. We don't want to help someone conceive and then find out there's a problem afterwards, which includes genetic screening of both members of the couple, and the eggs, both ovulation and egg strength, which we're going to talk about in a sec. Angela, will you hit the next slide? Right. So here's what makes people nervous, and maybe why all these people here on the attendee list are sitting here talking to us. That we know that there's this biological clock for both men and women. Guys aren't off the hook. However, it's way more severe for women, right? Women always shoulder a harder burden in life. I think we can all agree on that. And the main reason behind that is that while men can make new sperm throughout their entire lifespans, women cannot make new eggs. Every woman, every person born with ovaries is going to be born with a finite number of eggs. And that number has to last them through their reproductive lifespan. And there's a decrease in the quantity and quality of egg for everybody. Nothing. I don't want anybody's ovaries to get defensive on this call. It's just true for every single person out there. So if you look at this graph here, I hope you can see my caliper moving. That as age goes up, unfortunately, fertility rates go down. So the number one most important thing I can do for anybody who walks through my door is measure how much gas they have left in the tank, or measure their ovarian reserve. That's a fancy term for egg reserve. There are 4 ways we do it. We do it for everybody. First off is age alone. This will be the last time I bring it up, guys. Don't worry. Subtle decrease as early as 28 years old. That's insane. Very subtle, though. Very low, subtle. About 35, it starts to pick up. 35 to 38, you can see that the slope of that curve speeds up, but not terribly. But then starting at about 38 to 40, we see a very fast shift decline. And then after 40, it's like a very big deal every single year, right? So age is still the number one most important, biggest indicator of quality of eggs, bar none. In addition to that, though, there are three other individual metrics that we check. There's a blood test called FSH, a blood test called AMH, and we do an ultrasound of the ovary to measure how big it is and count how many visible eggs in these little fluid pockets called follicles. So AMH, the higher the better, FSH, the lower the better, right? And then the ovaries, you want a nice big ovary instead of a small ovary. You want lots of little follicles in them. The analogy we all use, all of us REIs, when we're doing ultrasounds, follicles look like little chocolate chips in the ovaries, and we can all agree the more chocolate chips in anything, the better, right? So that's where that biological clock kicks in, and that's where that magic number of 35 comes in. Now, there is no age, almost, I would even say between 35 and 42, that is a deal breaker. I would not say any of that is a deal breaker when it comes to what we have to offer people, but they're huge calls to action because fertility declines very quickly at that point. So calls to action means come in and see us, talk to a board certified reproductive endocrinologist, get interested in your fertility, do some evaluations, see where you are and see what your options are. All right. Now, there are some people who see this and are anxious and worried, but they're not yet ready to build their family, either for personal reasons, professional reasons, are in school or still trying to build their career, or they don't have a partner, for whatever reason, they're unpartnered. Those patients can freeze eggs. That's a big deal. You guys all hear about it. It's on TikTok all the time and everything. We freeze a lot of eggs these days, a lot of eggs, and it stops the clock. It's a really great way to do that. We'll do another webinar with Sunfish another day about that. All right, let's take about the next slide. All right, I did bring this up, the quality versus quantity. All right, there are quantitative measurements such as follicle counts, size of ovaries, and AMH levels. They're all very quantitative, but age is the number one best indicator of quality. There are definitely some people whose clock can tick a little faster or a little slower than other people, than average, right? And some people hold on to the quantity of their eggs better than others in their age group. However, no one can turn the clock back on quality. That is really the key concept to get across here. That's where that call to action comes from. All right. There are even people. That's fine. We'll go. No, we're good. Keep on going. All right. We're in the home stretch here, guys. Don't worry. I know you're all sick of hearing me talk already. Before we talk about IVF, which is something that's in the news and people are all interested about, what I really want to get across is every patient who walks through our door at Illume and should at any high quality REI center gets treated like a person, gets taken very seriously and looked at very thoroughly for a full and thorough fertility checkup. And we go through all of those things. Then I meet with the patients again and go through every single blood test, x-ray, ultrasound, every lab value. I flip my screen and I show them everything. It's not my data, it's yours. My job is to give it to you and explain it. At that point, though, we decide as a group, me and our patients, where I can start to recommend whether they need treatments or not and what those treatments might look like. Now, remember, anybody under 35 who's tried for a year without success and anybody over 35 with 6 months without success, I already know no matter what their evaluations show us that they need some help, right? So I always view my role as how do I push the gas pedal down? Because people wanted their baby last year, not when they're coming to see me now. And don't forget, if you're starting to build your family in your early to mid 30s, you have to hurry up and have the first baby so you can hurry up and have the second baby, right? These are constant conversations we have a lot. So I always view my role as pushing the gas pedal down. So we decide together whether I think they need treatments, and then we run through some of the options. Now, everybody thinks they have to go right to the high-tech IVF stuff. That's not true. There's low-level treatments, there's medium-level treatments, there's high-level treatments, there's extra high-level treatments, right? And so we fit what is best for that patient based on their data, their social situation, their age, what their goals are. So I don't want anyone to walk away from this and think that every time they walk in front of an REI, a fertility specialist, that they're going to be told to do IVF. That is absolutely not true. All right. We usually start off low and ramp up as needed, unless there's some deal breaker that takes you right to IVF. Okay. Some of those deal breakers might look like this: blocked tubes, which we test up front. Very low sperm counts, right? So mild sperm counts, we have like low-level treatments like inseminations, but severe ones, we have to go to IVF. Let's say both members of the couple are carriers for some horrible, even lethal genetic condition that doesn't affect them but could affect the baby. Well, you go right to IVF and you can test the embryo as to which ones carry it, which ones don't, and only transfer an unaffected one. Or if someone's like kind of pushing 40, like 38 and above, really all the textbooks say go right to IVF because it combats the biological clock the best. Or if they're younger, but their egg reserve is showing some weakness, that couple should very efficiently get to IVF. So those are some deal breakers, but then we take them right to IVF. Now, IVF sounds scary, especially on TikTok, right? But it's really not. There's some great benefits to IVF. So number one, super high pregnancy rates at high quality regional referral centers like us. Okay. We expect you to have at least a 60% live born rate per embryo transfer. Live born rate's a baby in your arms. That's not a positive pregnancy test that doesn't turn into a baby. We're very proud of that. Top 10% of the country. You should seek out places wherever you live who only have good rates. Okay. Number two, we only put in one embryo at a time. IVF is so good these days that we don't need to put in more than one embryo. As a matter of fact, we will not put in. Good programs only put in one embryo because twinsies are adorable, but they're not safe for you or the baby, right? The other benefit is we have the ability to do chromosome testing of the embryos before we put them in. So you can screen out things like Down syndrome and other chromosomal abnormalities that lead to miscarriage. It's called PGT. Okay. And the last thing is, and this is a very important point, hopefully we get 3, 4, sometimes even 5 embryos from somebody. Well, we only transfer one at a time. So the extras then can be cryopreserved, which is a fancy word for frozen, for future tries. So you come back to me in 2 or 3 years for another baby, we just sell an embryo and pop it in. And your future pregnancy rates, miscarriage risk, and Down syndrome risk, all the things that get worse as a woman gets older, would be based on your age now when you freeze it, not your age in the future when you come back to use it. So it's really cool life hack of kind of taking the focus, the laser focus of just getting pregnant right now, to widening your view and saying, hey, what do I want my family size to ultimately look like? And do I have to be proactive now to make that work? So there's some of the conversations and concepts we get across. Very, very briefly, I'm going to talk about what IVF really looks like, not like what the scary part is. And then I'm going to turn it over to Angela. All right. So basically, if a woman, well, women know this, men don't have no clue, but if a woman ovulates 1 egg per month, which is what's supposed to happen, that does not get the job done in IVF. IVF is a numbers game, and the more eggs someone gives us, which is a function of their age, their egg reserve, and our medication protocols, the more eggs they give us, the better off they're going to be. It's as simple as that. So we give them medications, which are exact copies of the same hormones that person makes. They are not like some crazy chemical we made in our lab. They are not. They're natural hormones. They are little injections. That part is true. TikTok's right about that. These little tiny whisper thin needles that go right under your skin, 1 to 2 shots per day for an average 10 to 12 days. Some people a little faster, some people a little slower, but on average about 10 to 12 days. During that time, we monitor the follicle recruitment, how many follicles are growing, how fast they're growing, to pick the most fertile day that is unique and personalized to that individual patient. It's not generic for everybody. It's your best day. So there is some work there to do ultrasounds and blood work like every second or third day while you're on the meds. When you are ready to go, you take a different shot of medicine called the trigger shot. That's the one, I'm sure you've all seen movies and like sitcoms. That's the one that's got to be an exact time that we tell you. Okay? No joke. Don't want to be dramatic about it. Don't mess up the time. And the reason for it is that we set your egg retrieval a certain number of hours later, usually 35 to 36 hours later. That's why the timing is so critical. The egg retrieval is a short, minor surgical procedure. You do it in our office. You don't have to go to the hospital. It's super chill. It's private practice. It's classy, in and out. You're sedated through a little IV in your arm. You go night-night. Everybody loves this stuff, by the way. Full night's sleep in 20 minutes. Every single patient wakes up saying the same thing. The eggs come out of the body through the vagina. No surgery through the abdomen at all. Not even a Band-Aid on your body. Literally, it's that cool. All right? Kind of in by breakfast, home by brunch. Have your partner take care of you all day. Most people go back to work the next day. Some people feel a little bloaty and distended for a day or two. Some people need an extra day or two off of work. But for the most part, most people go back to work. So we get eggs from her. We get a sperm specimen, whether it's from a partner or frozen donor sperm or something like that. We fertilize them together in the lab and we create embryos. The embryos then grow for 5 to 7 days in the lab, where the strong ones make it to the end. Down at the bottom right is a picture of a final mature embryo called the blastocyst embryo, or nickname them blast. And that's the name of the game, because there's a very big drop off from eggs to fertilization to the final mature stage called the blastocyst stage over days 5, 6, 7. But that's the name of the game. You want as many eggs so I can get as many embryos, blastocyst embryos, as possible. Modern IVF, we freeze the embryos. Okay, we do not do a transfer right away. We can either do chromosome testing on them before we freeze them or not to make sure there's no Down syndrome or other chromosomal abnormalities. That's called PGT. And then the next month, you do a single frozen embryo transfer in a natural cycle with no medications of your embryo. And the transfer is not surgical. There's no anesthesia. It's like super cool. You're both watching it. You're both there. You get pictures of the embryos. It's really neat. So the hard part is recruiting the follicles, getting the eggs, making the embryos, testing them, and freezing them. The easy part is doing the transfer the next month. So that's kind of modern IVF, separating out the egg retrieval process and the embryo creation from the next month to do your frozen embryo transfer. In our hands and the hands of good quality, big IVF centers such as ourselves, you should expect at least a 60% live born rate per single embryo transferred under those circumstances. All right. I know it sounds like a lot, but honestly, it's about 2 weeks worth of work. There's sometimes some waiting 2 weeks before, 2 weeks after you can start. So one cycle is 1 month, the transfer is another month. So that's 2 months, but it's 2 weeks of work. People think that they're on hormones for months and months and months. They're not. It's super chill. So I've talked a lot just because us doctors can't clear our throats in 10 minutes, right? But I think that was a decent overview about what I go over with patients, although I spend a lot more time talking to them, like an hour. But I'd love to turn it over to Angela and Sunfish. What I would say is for me, I've trained professionally my whole life and worked my whole life professionally to take care of these issues and help people build their family. And I can do that. My whole team is ready, willing, and able to help anybody who walks in our door. There's a big problem out there and a concern, and I bet a concern of a lot of people on this webinar is that sometimes insurance doesn't cover it. It can be expensive, and there can be some barriers to entry there. And that's why we're partnering with this great company called Sunfish, because I see it. Some patients, they don't have the insurance coverage. It's out of their reach. It's a really big barrier. Say, look, I can handle the medical stuff. You got to handle the insurance stuff. And that's where Sunfish comes in. I'm going to turn it over to Angela.
Thank you so much. So that was a fantastic overview of the process. And having been through the process myself and helped many, many patients go through this process too, we know that this is a lot financially, logistically, emotionally. And so it's really nice to have someone by your side. We at Sunfish work with leading fertility clinics. We are very selective about which clinics we work with to design an all-inclusive bundle for people who don't have full insurance coverage to help you along the way. We help you with the costs, we help you protect your investment in this process, and we help you throughout all the steps for up to 1 year as you're going through this process. So just to introduce our team a little bit more, I mentioned I've been through 4 rounds of IVF myself. Many people on our team have been through this journey as well. And we've brought a wide array of backgrounds to help be your partner alongside your fantastic medical clinic and make this process a little easier. So we have backgrounds in consumer insurance, consumer lending, best-in-class consumer technology. I personally previously was working at a venture capital firm in Silicon Valley. I froze my eggs. I realized what a challenging process this was to go through. So have been working on helping to make the IVF and fertility process a lot easier for nearly a decade now. And we've designed an all-inclusive program. It's a bundle called the IVF Success Program in collaboration with Illume. So it's based on Illume prices and in collaboration with your doctor. So each bundle is customized to each patient. It's an all-inclusive bundle that includes your retrieval and unlimited transfers for one set price, as well as a unique refund, a cash refund, if you're not successful in your cycle. And everything can be customized for you. So I'll talk a little bit more about that. And lastly, we offer a wealth of guidance and support beyond the exam room. So your medical team is going to take great care of you as you go through those procedures, but there's so many things that come up around, for me at least, conquering anxiety around each step, how to pack for my egg retrieval, all of those questions that come up. We, Sunfish, will be your support team along the whole process. So the IVF Success Program, just to share a little bit more about what it is, it's a single investment. This is an example package. Our packages actually start at much less than this at Illume, but it's one set price for your IVF journey. And that will include discounts, support, guidance along the way. It can be completely customized. So if you need to do a double retrieval, if you need to add an egg donor or a sperm donor, your bundle will be unique to you. At Illume, our prices start at just over $17,000 for a bundle, and that is really going to be an all-inclusive package with those unlimited embryo transfers, as well as a cashback refund if you're not successful on the first try, plus 24/7 digital support throughout the whole process. So just to give you a little more insight as to what this looks like, as you're starting off your process and learning about your treatment needs, each patient is going to receive a custom package. You can customize that package and choose from a few different options in terms of how much support you want, the amount of refund that you need back. And then Sunfish and your Illume team will be working with you throughout your entire IVF cycle to guide you through the journey. And if you're not successful on that very first cycle, you can get up to $15,000 back in cash. So that amount is cash back that Sunfish will give you to try again. We actually see 90 plus% of patients will try again if they need to. Of course, we hope that you'll be successful on the very first try. So as you're thinking about your IVF journey, at least for me and a lot of patients that I've worked with, they've said over the years, hey, Angela, this is a big investment. I want to know it's successful. It's not like, once you're going through it, you obviously hope that you're successful, and your chances are much higher when you're working with a best-in-class team like the Illume team. But most people do need a few cycles of IVF. And just to clarify, a cycle is what Dr. Hurwitz talked through earlier, where you're getting that egg retrieval and then doing multiple transfers, one embryo at a time, to try to achieve pregnancy. And so we obviously hope you'll be successful on the very first try, but just in case you need a little extra support, that single bundle is going to be supporting you throughout the whole process. Once you enroll, you don't have to pay anything else. All of your transfers will be included, as well as a number of other discounts. So we include a lowest price guarantee on all your medication. We include discounted mental health support if you need to speak with a therapist who specializes in fertility care. We include free multivitamins, a whole bunch of discounts to support you throughout the process. And we're going to be your cheering squad throughout this journey as well, and your support team. So once you enroll with your custom package, the Sunfish team will be sending you flowers at your retrieval. We'll be sending you care packages. And all of those discounts add up to $9,000 in savings per cycle per patient when working with Sunfish. On top of that, you do get that guaranteed refund if you're not successful at any point in your cycle. So if you don't have high quality embryos, the transfers aren't working, for example, or even if you do achieve pregnancy, and this is very, very rare, but just in case you're not then graduating to your OBGYN at the end of that first trimester, if anything happens at any point, we would give you that cash refund back. So this is a really nice program. We've had many patients go through the process and just heard such wonderful things about how this all-inclusive bundle is able to give you peace of mind and really support you in a more comprehensive way to supplement everything that your incredible Illume team will be doing. So with Sunfish, we've had so many patients talk about how priceless the support is that we offer to help you put your best foot forward, to help you optimize your chances of success as we're guiding you through the process, and to give you that financial peace of mind. In addition, if you do need financing, if you do need loans, we have an incredible array of lenders that we work with. Everything from HELOCs, if you wanted to use a really low rate option, you can obtain a home equity line of credit through Sunfish, or just a regular unsecured loan. So we're going to be there every step of the way. We absolutely love working with Illume. As I mentioned at the beginning, we're really selective about the clinics we work with, and Illume is best in class. Success rates are very high. And of course, we hope that you get pregnant on the very first try. So this is how you can find out about the program. Go to joinsunfish.com/successprogram/Illume. We'll email this out at the end, and Josh and I can stay a few minutes later to answer any questions. I see a few have come in, but the last few things I just wanted to share. If you attend this webinar and enroll with us within the next 45 days, you will receive $600 off your bundle. This is how you can contact either us or Illume. And if you have your first consultation with an Illume doctor at any of their locations by June 15th in the next 45 days, you'll get $100 off as well. So these are just little gifts. We both really, really care about helping you on your journey. We'd be so honored to support you. I know it's a lot, but if you're at all thinking about the process or just want to learn more, this is a great opportunity to reach out. We never want to rush anyone, of course, but this is a great opportunity to reach out, just learn more. It's free to set up a consultation with Sunfish, and you do get that discount with Illume. And so with that, I've seen a number of questions popping in, which I really appreciate. We'll stay for a few minutes, as I mentioned, just to address any questions that come up. And of course, we'll send this out as well. So the first question that I see for you, Dr. Hurwitz, is how should I choose an IVF clinic? I know we talked a little bit about some of the things to look for, but just a couple more thoughts on how people can find the best clinic for them.
Sure. Obviously, you want to find top doctors, top success rates, right? That's obvious. Everybody wants to find that. Want to make sure you find a place that treats you as a person, right? And that they're not going to look at you as a number and they're not going to move you through just like a number. I think that's really important. You have to find a place that's close to you. IVF can be work, right? Even though it's a couple of weeks, it's frequent visits. You want to make it sort of geographically appropriate for you. And really, I think I can't stress this enough. Go to a place that's dedicated to you, that is on your team and really cares about your success. Maybe not as much as you, but like next in line after you, that like cares about your success. I think that's really important. You can look up success rates through the CDC. There's an organization called SART, Society for Assisted Reproductive Technology, SART.org. And you can look up national clinics about what their fertility rates are. It's always a couple years in arrears. Like you can't have like today's rates. It's usually 2 years in arrears, but you can look those up. So if you're looking at a place, everybody's going to announce that we're the best, but back that up, look at it. And also, you can talk your OBGYN. They can also give you good insight as to who's good in your area, who they like to work with, who gives them patients back in a high quality manner without complications and things like that.
Yeah, that's great advice. And I'll just add, we Sunfish our company's very selective about which clinics we offer this all-inclusive bundle at, as well as the money back guarantee. So, we're putting a lot of trust in the doctors at Illume because we know that it's a really excellent clinic and we're able to offer that guarantee, that financial protection only at select clinics. So it's something that I think really is a testament to how much we believe in the high quality care at Illume through this all-inclusive bundle. All right, a couple more questions. I got one for me. Having insurance doesn't fully cover IVF. Would Sunfish help with the remaining balance? Please contact us so we can discuss. Absolutely, if you have some coverage, for example, some people have coverage for monitoring the blood work, we can offer a deduction on the bundle to help you move forward with that. So please contact us and we'll do our best to work with you and any insurance coverage you may have to ensure that you're paying the lowest possible price. Great. I love seeing these questions come in. When should I speak with someone at Sunfish or at Illume? Okay, so as people are getting started, I would always say speak to us as soon as possible. It's obviously important for us to get your unique treatment protocol from your doctor because we design your custom bundle based on that. But if you're starting to think about the financial side of this, we can help you come up with a plan. Sometimes if you also need a loan, for example, if you need financing, we can help you ensure you put your best foot forward there, add a cosigner. We'll just work with you throughout the process to ensure that you can move forward with fertility. Time is of the essence. We talked a little bit about how important it is, especially for women, to think about age. So our goal is to help you get started as quickly as possible. And actually, when patients connect with Sunfish, we see that they're able to start their journey twice as quickly as without Sunfish, which is a statistic I'm really proud of because our team is going to be there to help you along the process. And Dr. Hurwitz, when would you recommend someone reach out to Illume? I know we talked a little bit about timing at the beginning.
Well, so traditionally we say, 1 year under 35 without success, 6 months between 35 and 40. And honestly, after 40, come in after like 5 minutes of trying. That's usually what we say. What I would also say is that these are just check boxes in a textbook. Not everybody's a checkbox. So if someone's anxious enough out there, right? that they are nervous. It's been 4, 5, 6, 7 months, and there's something nerve-wracking going on. It's not sitting well with you. Come on in. Even if it's just for fertility checkup, why live with anxiety, right? Get to know maybe there is something wrong and you just short-circuited half a year. The other thing is that those timetables are only if there isn't something obviously wrong. So if a woman has irregular cycles, that means she's not ovulating properly. Why wait a year? That makes no sense. If she's had a lot of uterine surgery or a lot of tubal surgery, she has known endometriosis, or if the partner has a known problem with sperm or suspected problem with sperm, why wait? Come on in. Let us do our thing. Let us do a little bit of investigation, and then just make sure that you're not missing something. So I would say those are some generalities, but really there's no reason not to come in if you're anxious enough or if there's a reason to make you anxious.
Great. I'm going to stop this share. Again, we'll send this out just for the last few questions so everyone can see the two of us. Last couple of questions that have come in. Are there requirements such as AMH or age to qualify for the money back guarantee? So that's a great question. With the all-inclusive bundle, there's actually no eligibility requirements, which is really unique. I personally, having been a patient and worked with so many patients, really wanted to create something that's inclusive. We believe everyone should have the opportunity to try to build their family. So you do not have to have a certain age or AMH. Everyone will qualify, and everyone will qualify for that cashback guarantee. The cashback amount will vary for each patient. There's a range, but we'll let you know up front what that estimated amount is. So please contact us if you're considering. All right, if you have I have partial insurance. I'm about to start with Illume. How do I proceed with Sunfish? Again, please reach out to us. It depends on what your insurance covers specifically. But we can often tweak the bundle. For example, you may be able to use your insurance for medication or the PGT testing that Dr. Hurwitz talked about, genetic testing, and Sunfish can help you with the rest. So definitely contact us if you're considering. Another question for you, Dr. Hurwitz. Who is the Sunfish IVF Success Bundle right for? Would you recommend it for?
It's a great question. So first you go through the full medical workup and figure out what's holding you up and see if IVF is the most best treatment option for you. Once it is, you have to look what your barriers to entry are, right? So if you don't have insurance coverage, or if you have very minimal coverage, or if you've been through IVF and you run out of coverage, I think Sunfish is a great way to help share the cost and share the risk with you as you go forward. It's really heartbreaking for me to know what a patient needs and know that I can help them, but they having trouble walking through that door because it's just out of the way financially for them. I talk to people, I was like, look, some people get second jobs, at Amazon and Starbucks. Some people switch jobs. Some people get their own insurance, but those are like hard things to do. Whereas Sunfish, you talk with them, sign it up, and you have a really good team on your side with you. So I do like for us to quarterback the patients, come in, talk to us, but very early in the process to get Sunfish involved.
Absolutely. I agree with that. Anyone who doesn't have full insurance coverage and is going through IVF, we recommend they reach out to us. We'd love to help. We offer a lot of support and guides for free. So if at the very least, we can be your thought partner as you navigate this journey. And if you decide the bundle is right for you, we'd be very honored to help you as well. We've seen a lot of patients go through success, and we like to just be that additional partner alongside your clinic to make this process a little bit easier. So with that, I think we should wrap up. I see a couple more questions. Is it okay to see a doctor for consultation and then reach out to Sunfish? Yeah, absolutely. As Dr. Hurwitz mentioned, let's make sure IVF is the right treatment for you, but you can always start in either place, and we will help design a package for you once you've met with your doctor and you know exactly what treatments you're going to need. And yeah, if you have any questions about the discount that we're offering today, we absolutely will honor that for anyone who's in the webinar. And let me just make sure I got all of these. Yeah, if you need to use an egg donor or sperm donor, the bundle would also apply to you. So we can help in those cases too.
Angela, what about a gestational carrier?
With a gestational carrier, we don't currently have a bundle. We are planning to launch that later this year. And same for just egg freeze only or embryo freeze only. We'll be launching those with Illume later this year. So stay tuned if that's
That'll be our next webinar. That'll be our next webinar.
exactly.
Yeah,
Yeah.
yeah.
Well, this has been so wonderful. Again, I know all of the doctors at Illume are really a wealth of information, and they're all so wonderful and patient. Our whole team loves working with your team. And so I can't recommend more highly just starting the process to learn, ask your questions, see what you feel comfortable with. For me, it's been a very long journey, but I'm so grateful to have an incredible system of support and great physicians to help alongside this difficult process. And every single person at the Sunfish team is so excited and honored to help people navigate this journey. Dr. Hurwitz, any final closing remarks from you?
Wonderful sharing this webinar with you, and I really just want to wish everybody good luck. And I'm going to tell them through this electronic medium what I tell people when I meet with them is that you've already done the hardest part. You know what the hardest part is? Walking through our door, right? Just walking through the door, saying, "Hey, I have a problem with something that's really personal and very difficult for me to talk about, but I need some help." You've done that. You've walked through the door. You've heard that call to action. So I really commend everybody here, and I wish everybody a ton of luck going forward.
Great. Well, we'll follow up over email. You know how to contact us. And we would be so, so honored to help you build your family. Thank you, everyone.
Good night, everybody.